want it, you're going to get it. If you want it how you say you want it, you're going to achieve. You cannot study the same for each class. Every class has, and now I feel like I can tell you what school I went to. So the school I went to was PI. We're going to have a lot of hiccups and bumps in the road during this program. Things that never happen to you are going to happen to you when you start nursing school.
You'll get every little bit. You ain't never seen a drip like this. Heaven at your fingertips. Don't you let a minute slip, just.
Hey y'all, welcome back to another video. If you are new here, please make sure that you like, comment, and subscribe. And if you are returning, welcome back. But if you are new and you don't know what my channel really consists of, this is a nursing, lifestyle, fashion channel. So if that's something that you are interested in, please make sure that you subscribe and put your post notifications on so you can know when I drop a new video, period. But welcome. I first want to say thank you guys so much for all of the congratulations and well wishes. I really appreciate y'all. I've read and I tried to respond to all of you guys' messages, and if I didn't, I'm getting around to it. So thank you. I read every single comment. And I really appreciate you guys, like I really do, and thank you so much. And if you are about to start nursing school or you are in nursing school, I just wanted to give a video because I had some people ask me like, oh, how did you study? How did you get through your program? So I was in an LP and accelerated program. My program was 12 months, and now I feel like I can tell you what school I went to. The school I went to was PIT, Pennsylvania Institute of Technology. Is in Media, PA. That is close to you guys. I recommend it. It's a really, really good school. It's tough though. Like they real stiflers about their policies and procedures. It's a really good school. Like, to get the information and prepare you for everything, I can say that it's a really good school. Some of the people in my program already started taking their NCLEX and they passing, baby. We probably had 2 people that didn't pass, but they are passing their NCLEX. So my school really is preparing us for this exam. I didn't take mine yet. I do have a date, and when you guys see my next vlog, you'll see me going to take my test and, you know, giving y'all the spill on that. So make sure you put your post notifications on so you don't miss that video. But like I said, I want to give you guys some tips on how I studied, what classes I took, how the program was, just anything I could do to help. I want to share that with you guys that are going or already in the process and you just need, you know, some pointers. But yeah, let's just dive into it right now. Okay, y'all, so don't mind my writing on my wall, and I have sticky notes on that wall. I'm studying, like I told y'all, for my NCLEX, so I'm just like having everything around me so that I can keep on looking at it and not forget it. Anywho, but yeah, so the school that I went to, like I said, was in Media, PA. So backstory. So my program, they required a, you could either take a class for your prereqs. They offered the anatomy class, and then it was like the TEDS. You could either do the TEDS test or they offered a TEDS class, like a course. And I was so nervous about the TEDS exam, I decided that I wasn't going to go that route. I was just going to do the class. Like, if baby, you can teach me something and then I'll take a test. That works best, because I didn't come from healthcare. I originally started my career and got my bachelor's degree in criminal justice. So I was coming from a whole different field. So I really didn't know anything about healthcare, although I did work in a hospital as a psych tech. But other than that, I really didn't have any, you know, knowledge of like working in healthcare. So I decided to do the class. Now, don't quote me. I don't know what they're doing now so far as like requirements or, you know, prereqs to get in. But when, like I said, last year when I started, it was the TEDS class that I took in the anatomy and physiology course. So I started both of those October of 2023, and they were both 3 months. They started at the same time. I did online for both classes. I'm like, yeah, that works perfectly. I could still work, stack my money, because for those of you that don't know, I had to pay completely out of pocket. Like I told y'all, I have a bachelor's, so I exhausted my financial aid in my first degree. So I'm like, okay, cool. So I was like saving money and I was still working, but I started the program, like I said, my prereqs, the pre-nursing, in October, and then it was done in December. And then the nursing program started January 8th of 2024. So going into it, I was like, dang, like I got one shot of this, like one literal shot. Like I don't got no money to pay nothing over. I moved from my apartment to move back to my parents' house. Well, I haven't lived with my parents in forever, but I moved to my parents' house so that I could afford to pay my tuition or whatever. And the first classes that I took were, what did I take? I actually wrote it down for y'all because I don't know why I'm having a brain fart right now. But I took fundamentals and role development. Okay, so how I studied for each class. I feel like in the whole nursing course, I didn't study the same for each class. If you understand, like if you follow that, like I feel like you cannot study the same for each class. Every class has a different way that you have to study to pass the course. You know, some of the classes I was able to study the same, but some of the classes I didn't. But like I said, I started off with fundamentals and role development, and a lot of people in my program was having a tough time with role development, and actually that was my strongest class. I actually kind of like struggled with fundamentals. Like I said, this is my first time coming into nursing, my first grade that I ever even got. Like my first exam, I remember everybody saying they grade, what you get after the test, and I got a 70, and I was pissed because I'm like, damn, like, all right, I gotta find a way to study. But one of the girls that was ahead of me, she like gave me tips. She actually followed me on Instagram, and she was like, oh, I see you going to my school, whatever, I got some tips for you, and she shared them with me, so I'm gonna share them with y'all. Okay, so I'm not sure how a lot of you other the other nursing programs are, but my school give out study guides. I think they gave them out for every class except for mental health, which is weird, but they gave out study guides for us, like, so we know like what to like actually study, so we're not just studying a whole bunch of stuff that we don't need to study, which helped a lot because I was thankful for that. And my school also record the lectures, and the professors post them on Canvas so that you can go back and listen. And I loved it for us because that was very, very helpful. Like, and I felt like that's what saved me, because if we didn't have that stuff, especially a study guide, baby, I don't know what I would do. But these were my methods for like fundamentals, and for role development, I did something else. But for my fundamentals, I literally wrote. I got a blank paper. Actually, the girl did it for me because my handwriting sucks, but it is like whatever topic we're learning about, and then like all of like the adverse effects, side effects, nursing interventions. You would write on here like the steps by steps, and I wrote that for like every single class. Comfort, rest, and sleep also did that. Like whatever topic we had, I wrote everything. And well, like she wrote everything, and then we also made sure that we did it in different colors. Like I don't know how y'all brain work, but like if I see different colors, that actually help me remember too. So like I literally done that, like even vital signs, like I did a blank paper with everything on it. So I would suggest doing that, because like writing and then the different colors, that actually help with memorization. And then even with safety, everything that we learned, like literally every topic, get a piece of paper, get some color pens, and write it. Literally write it out. Write everything, every topic, and then write I would suggest writing the adverse effects, the side effects, the nursing interventions, the lab tests, like anything that related to what you're learning. That was really, really helpful, because I feel like you know what the whatever it is that you're learning about, with what can go wrong, and what to do if something goes wrong, and what not to do if the patient is okay. So I think that was very helpful for me. I suggest you guys study like that. I also watched a lot of videos with Professor D, Nexus Nursing on YouTube. Okay, y'all, so that is basically how I studied for fundamentals. It was also me going on YouTube and watching Nexus Nursing with Professor D. She's going to yell at you, y'all, but you're going to remember this shit in your head when you're taking them exams. So those two things, and I probably watch a little bit of Nurse Sarah videos, but her voice irritated me, so I stuck with Professor D. And I like how Professor D does questions. That's another thing. Like, y'all, start doing them questions now. Like, start doing them questions, familiarizing yourself with these diseases, with these safety questions and prioritization questions, because you're going to see these questions again. I feel like keep seeing the same questions, but they asking in a different way, or it's a different selection of answers. Like, I just feel like start doing that now. If you don't know what to do now, start going over, like, and especially if you're not familiar with or have a healthcare background, start going over like vital signs and physical assessment. That's like the basic stuff that you're going to start learning, and fundamentals in your labs. So make sure you do that. For role development, I honestly, y'all, just listen to her lectures and literally read off the PowerPoint. Sometimes the PowerPoint is all you need, because yeah, sometimes they just take everything off that PowerPoint and put it on the exam. So that's how I studied for those two classes. Moving along to the next class. Those was the two classes I had for first semester, and I had clinicals, of course, and I had my labs. Next semester 2, I had Pharm 1 and Med-Surg 1. For pharmacology, how did I study for Pharm? Oh, this is how I studied for Pharm. I was making flashcards, y'all. I was making flashcards, and I had that Nurse Sugar book. Hold on, let me get it for you. Okay, y'all, so this is the book. This is owned by a black woman, and her picture is on the back. The book was probably $100. Yeah, it was $100. I got it exactly off her website, nursesugar.com or .org. I'm not really too for sure, but y'all, that's basically how you're going to learn Pharm. There's no other way. Flashcards is literally unless you could just read the PowerPoints or remember, but I would say for Pharm is memorization, literally memorizing those meds. I feel like Pharm 1 was not as hard as Pharm 2, because Pharm 1, all of the endings to the words, you knew what class they was. Like, it was easier to memorize them, if that makes sense. If it don't make sense now, it would make sense once you start the class. Like, all the beta blockers, the ending of the words had LOL, so you know that's a beta blocker medication. Bye. So I feel like Pharm 2 with the other meds, it wasn't like that. They had different endings. It just got a bit confusing, but I would say the only way really for me that worked for me was the flashcards. The flashcards were wonders. And then for Med-Surg 2, for Med-Surg, I also opened this book. She literally has everything in here. Every thing that we learned, like when you open it, she got like little stickers and then like a speech, and then she literally has like fundamentals, assessment. She even got the math, pharmacology, maternity, peds, mental health, everything Med-Surg 1 and 2 in this book. So it was really good. And then she has like it's pictures, it's color coded, like it's really like anything I wasn't understanding, I was going to this book to actually go over everything, and then comparing it to the stuff on my slides and comparing it to the stuff in my F.A. Davis book. That also helped too. So yeah, like literally I started to learn like in term 2 that when you read from the book, that's the best learner. That's the best teacher. Like the book. Like literally reading from the book. And I didn't know that until my term 2. But yeah, I didn't do the whole thing writing on the page come term 2 because it was so much more information. So I just felt like me writing all of that, I wasn't going to remember. Me actually doing the flashcards and doing, what is that, recall, I was learning the meds like this. So yeah, active recall, that's what it's called. So yeah, that's how I was learning for those 2 classes. And also Nurse Sarah had a lot of little videos with everything on there. And that other lady, who that other lady? Nexus Nursing, Nurse Sarah, and she got the little flashcards. What is her name? I don't know. I can't think of it right now. But her too. And Nurse Mike. Like, I feel like the YouTube teachers was teaching me more than my teachers. I honestly think that I got lucky in my program because we had all of those things like study guides and like recorded lectures, so that I can actually, if I really don't understand something or remember something, I can hear it multiple times. Or if I don't understand how they saying it, I can watch another video on YouTube and understand it, or I can read it in my book. I didn't go as far as buying all of those extra things. I didn't really feel like I needed those things, like all of them other bundles. I only got this one because I heard really, really good things, and it was even said that it helped with NCLEX, and it actually says best prep for next gen NCLEX. So I'm actually using this also to study for my NCLEX. So yeah, but that's the only reason why I got the bundle. It's like the only bundle I ever bought or anything. Nothing outside of like what the school gave me or like the books the school gave me. This is the only thing that I ever bought, and I'm going to buy. I'm not buying nothing else. I feel like this was enough and covered everything that was important that I needed to know. So it didn't have nothing that I was learning it didn't have in this book. So that is how I studied for Pharm and Med-Surg. I did the same thing with Pharm 2 and Med-Surg 2. And I would recommend you guys getting a whiteboard, because what I did was I did the flashcards, and then I would like probably have a flashcard in front of me, and then without even turning it around or like me just going over meds, I would write it on the board, and then or I have my mom see the card and I write what the adverse effects or whatever I know about it and turn it around. Like, that helps a lot too. Hold on, baby, I'm parched. All this tea. Excuse me. They can't ever make me hate ginger ale. Period. That is how I what was I? That's how I studied, y'all, for Pharm 1 and Pharm 2 and mental health. And Med-Surg 1 and 2. That's how I studied for both of those classes. We also had an IV class. It was online, and I really didn't pay that no mind, y'all. I actually was reading the information right before the exams. You can't teach me no IV or no skill in no online class, baby. I gotta do the skills. So I learned more about it when we did the skills. So that's just what my school do. But like I said, that, excuse me, damn. Term 3, it offered the IV online, partial online course, and then I had the Pharm 2. I told y'all how I studied for that, and then I had the specialties, mental health, maternity, and peds. Now, y'all, I was a site tech at the hospital, like I told y'all. That's like the only like that job that I had right there. It made me want to be a nurse, like being around the nurses. But y'all, why mental health was my hardest class. Like, that literally almost took me out. And I don't know if it's because my school, when we got to mental health, like, they literally, term 3 is the hardest term because they literally squeezed the IV class, Pharm 2, and the specialties, which is mental health, maternity, and peds, all in one term. It's like you take in the Pharm and the mental health from the beginning to the end, but the other like specialty classes start and finish at a certain time. Like, they had a certain amount of weeks, and then you start the other specialty, if that makes sense. Like, we started, I don't know how else to explain it. Like, one of them started, and then when that one ended, the next, like, when mental health was done, maternity started. When maternity was done, peds started, but we still had pharm and IV class, like, but those was, like, spread out. So we finished everything at the same time. If that makes sense. I don't know if I'm explaining that right, but mental health was my hardest class in nursing school. Like, literally, and it wasn't like it was a hard class. It's just the way they ask the questions is really tricky. Like, you can't ask why. Like, you can't. It's certain ways that you got to speak to the patients. It's just like certain different precautions that you would take from a normal patient. So that stuff was tricking me up. And then the exams was like only 20 something questions. So that means you can't get that many wrong. So that was my hardest class. I had ended up with a C in that class, C plus. C's get degrees, but yeah, I literally can't even tell y'all how to study for that, because I feel like you can't study for mental health. You just gotta know what to do. So that's just it. And then maternity, I actually had to watch videos. Like, me learning maternity, I actually had to turn on them YouTube videos. Like I said, next is nursing, Nurse Sarah, and there's Mike, and there's that other lady I can't remember, but her too. Like, I had to watch videos because I wasn't understanding. Yeah, it was like preeclampsia, eclampsia, HELLP syndrome, and everything was actually sounding the same. And then I watched the videos, and they kind of like broke it down. Okay, preeclampsia is pregnant people that have high blood pressure or hypertension when they're pregnant. And then it was like, okay, eclampsia, okay, you have these symptoms of high blood pressure, but you'll also have like the seizures. And I'm like, oh, okay. And then the HELLP syndrome, I'm like, oh, okay, I'm starting to understand this. It's starting to make sense. So like I said, watch those videos, try to do questions, because them questions is but so many questions they can ask. Like, even on the NCLEX, I feel like some of them questions you're going to see again. So start getting and familiarizing yourself with those questions, because they really are helpful. But yeah, like you're starting to notice that I didn't use this method, but for my first semester, and I think it's probably best too that you can do it. You can probably use the same method of writing down and do the colors in Med-Surg when you're learning about the disorders, because I feel like that's the same thing. You can write whatever disorder at the top, write the adverse effect here, write the contraindications here, write the nursing interventions here. So you could probably do that. Like I said, y'all, I didn't have the best handwriting, and I had somebody do these for me. So yeah, but you can actually, that might work for you when you hit Med-Surg, when you're learning about all them disorders. And for peds, because peds, you learning about the same disorders in adults, and then you learning about them in kids, and then the kids got other disorders. It's just, yeah, do that. If that works for you when you do it in, fundamentals or in the beginning, do it for Med-Surg too, and then watch the videos and then answer questions. That all is going to all start coming together and making sense. That's what I did. And then moving along after that, after all of them classes, my last semester was Med-Surg 2, but I told y'all how I studied for that. And then Capstone. Capstone is just preparing you for the NCLEX. It's just going over everything you learned put together in one class. It's basically was a repeat of role development, going over all of the stuff that we learned in role development, and learning stuff for NCLEX. And we actually took at the end a comprehensive predictor test. Why am I spitting? We took a comprehensive predictor test basically to determine what our probability will be of passing the NCLEX. And I did really well on it. So I am excited to be finished. That was the whole 12 months. My program was the shortest program that I seen in Philly. It was a 12-month program, literally started on January 8th and was done December the 20th. Didn't have to take any classes over. I feel like if you guys follow the things that I did, you should be okay. Like, it literally is the best study methods, in my opinion. I did really well in my classes. Like I said, I think every class I got a B plus in. I didn't get my A. I'm not like an A student, but I'm like an average student, but I I did my best with these classes, and like I said, I got B plus and B minuses in these classes, and then for mental health I got that C plus. So that's how I did, and that is what I did to study. Now, if you are about to start nursing school, let me just give you girlies a little advice. I would suggest that you, when you are about to start, or if you're thinking about starting, you're going to need a support system. And I know that may be hard for some people because I'm not one to like ask people for help. I get things done on my own, but you're going to have a lot of hiccups and bumps in the road during this program. Things that never happen to you are going to happen to you when you start nursing school. And I always listen to stories and stuff of how people are saying these things, but no, I literally never went through the things I went to until I started my nursing journey, like literally. And then I think it would have made matters worse if I had a child. Like, I couldn't imagine having a child, but I really think that you're going to need a babysitter number 1, a babysitter number 2, and a babysitter number 3, just in case that one fall through and you need somebody else. Like, literally, you're going to need all the help that you can get to get through to the other side, because this is something that you're really, if you're not ready to sacrifice this year to get this degree, don't even do it. Don't even do it. It's not for you. I think this program, like, if you really lock in and willing to learn, and you're going to have to bite your tongue because the professors is going to try you and you can't really get smart with them, or you're out of there. If you miss 3 days of the program, you're out of here. If you're late, you're out of here. Like, it's you only could be, like, for each semester you can only, really miss 3 days. If you're late, that counts as an absence, so you're done. You're gone. You're out of the program. They really strict. Like, they don't play no games, people. They don't play no games. So you gotta humble yourself. You got an attitude problem, baby. You gotta get therapy before you start. You really, where's my lip gloss? You really have to want this. You gotta want it, and you gotta be willing to do whatever it takes to get what you want. And that's just point blank period. Lock down for this 1 year and get that nursing degree, baby. Yeah, you're gonna need that help. Do the studying, learn the information, and it's not really that hard. Like, it's hard, but it's not really that hard for somebody that really want it. That's all I'm saying. So take with you what you will with that information, but I hope that helped. I'm excited to be done. I'm just as nervous as anybody else, the next person to take this NCLEX, y'all. I don't give a freak how smart I am or what grades I got. That test scares me. Like, I had testing anxiety. Ask my classmates if y'all see them. I was the last one to leave with each test. Not the last one, but probably the second to last. Like, I will sit and reread the question even if I know the answer, because sometimes they ask in the question and it's tricky. They try to trick you up to really know if you're paying attention to the information. So I would say take your time when you're doing those exams. If you don't really understand something, look up them videos and let them clarify some things for you. But yes, that is my tips. I'm trying to think if I forgot anything that I forgot. I told y'all what program I went to. I told y'all how long the program was. I told y'all what I had to do before I started the program. I told y'all how I studied. I told y'all that y'all need to lock in before y'all start, because they don't play no games at these nursing programs. And did I tell y'all how much it was? I don't think I told y'all how much it was. I think it was like 30,000. It was like 30,000. And my payment, and they did let you do payment arrangements. My payment arrangements was high as hell. It was like $2,000 a month. Yeah, they was high. So yeah, it was high. Yeah. What else can I tell y'all? The course before the program, classes, how to study, clinicals. Clinicals. What I need to tell y'all about clinicals? Though, like, you could probably be late to your lectures or whatever, but when you got the clinical days, you cannot be late. You only can miss 3 days, or you are dropped from the program. You want to wear comfortable shoes. They might have changed it, but I think they did change it towards the end, because I was wearing my, like, comfortable pink clogs in the beginning to the end, and then they like told me I couldn't wear those no more to the end. I don't know if they requiring a different color sneaker now, because they told me I had to wear like sneakers, but I don't think they told us what color. But I think the class that was coming in after us, they was like more strict with them with that. I do have a video of like all of the supplies that I bought. I'll link the video here so you guys know what video I'm talking about, so that you can see the stuff that I bought for clinicals and for school in general. School supply lists, things that you need, things that you don't need, etc. But yeah, I hope this video helped. If you guys have any other questions, or if I missed anything, please let me know in the comments, and I'll tell you personally what my advice would be to you guys. But I wish you guys the best of luck on your journey. Don't give up. That's easily said than done, but you got this. I just feel like at the end of the day, if you want it, you're going to get it. If you want it how you say you want it, you're going to achieve it. Because I just feel like if you put in the hard work, the only thing you're going to come out with is the outcome. You know what I mean? You're going to come out on top. So do what you got to do. Keep your head down. Grind it out and get it done. Period. I am going to share with y'all how I'm studying for my NCLEX, but you guys are going to have to tune into my next video to see how I'm studying. You guys, I'm going to take you with me to go take the NCLEX. The 48 hours waiting after I take my NCLEX, I'm going to give y'all all that spill in the next video. So I'll see y'all in the next video. Good luck to y'all new nurses or nursing students, and I love y'all, and I'll see y'all in the next video. Real quick before I leave y'all, make sure y'all really tune back into my next videos, because I'm not stopping after nursing school. I'm going to take you guys to the NCLEX. I'm going to take you guys to me finding my new apartment. I'm going to take you guys to me starting my new job. I'm just going to continue this journey. I feel like people stop their vlogs when they're done nursing school, but no, I'm going to share the afterlife, like what to look forward to after. So make sure y'all come back to watch them other videos. But I just wanted to tell you that real quick. I love y'all, and I'll see y'all in the next video.
You'll get every little